Hi, Linda.
Hello.
Can you tell us your story about how you've worked with the techniques that we learnt in the training?
Okay. Well, basically, the last time I had someone who had a body mass index, BMI of 34, I totally blundered that one up because I just faced a brick wall. But that was before the motivational interviewing. But afterwards, then there was an opportunity. Another woman presented, second baby. She was booking in at 14 weeks. And she had a body mass index of 32, and she had a previous gestational diabetic, and I thought, there's some opportunities I can talk, some avenues. And she came in, she was all very friendly, and then when we eventually talked about the body mass index, I said, do you understand what that is? And she goes, well, I know I'm overweight. So she sort of already knew it, and she said, and I know that I had previous gestational diabetes, and they said that I might have it again. And I said, yeah, well, that's true. And I said, well, what are your thoughts about your weight?
Excellent.
And
fantastic.
So just using open-ended questions, which that workshop
opening it
really
up
helped.
to the woman. Yeah.
And then I just sort of sat there and listened, and she just spilled out all this sort of other stuff about, well, I'm trying to get a personal trainer since the last time I had, the last baby. And she's been doing some sort of little things with the personal trainer, but she was worried then about asking. She said, would I be doing too much if I did some certain moves or too much jogging or something like that? But I said, just remember to tell your personal trainer that you're pregnant.
Yeah.
And she was saying, well, and then we talked about, I said to her, okay, well, apart from exercise, what are your thoughts about anything in relation to your weight? And she said, well, I do eat chocolate. But she sort of stopped there, but it was only until we got back later when we talked about the alcohol and drug screening, when we talked about caffeine intake, then that only brought out actually how much chocolate she took. So she was saying she took about 2 to 3 chocolates a day, 2 to 3 servings of chocolate. So sometimes she would have it for breakfast. And I just tried to keep my face still as possible. Yeah,
and do a lot of nodding really?
Rather than shock.
Right. Okay, tell me more.
So she said she would eat quite a few times during the week as well, and then she started. When she said that, then I could see her face change and she probably had a self-realization. Ooh, okay. That's probably where it is. And then we...
Excellent. So she came to it herself.
Yeah.
She didn't need you to tell her because you led her there.
But she was obviously in the contemplating process because she's already been thinking, and for her to think that was awesome. And then I said to her, well, have you thought about how you might want to change that? Or do you see that as a problem?
Yeah,
and she goes, well, yeah, that's a lot of chocolate. So then she said, okay. I said, well, what are your thoughts about changing the diet? And she goes, well, maybe I might substitute it for something else instead. And then I thought, wow, that's awesome. And I said, what kind of thing? So, well, maybe a fruit or something. So then the next visit, at 20 weeks when I saw her, she was excited and she said, do you know what I did? And she goes, I said, what? And she said, I've actually, instead of taking chocolate in the morning, I take a strawberry. It's still sweet, but it's healthy, she said.
Fantastic.
So
she made that change herself.
She did, yeah.
Yeah.
So
that was really
great.
Good. And how different was that from how you said that you had tried you tried to speak to another woman about her weight, but you'd had a brick wall. What do you think you did differently this time?
I think I just went into, well, what are you going to do about it? Or I think the main thing was, instead of asking her questions, I think I sort of went into, well, maybe you could talk to the dietitian, so I was very prescriptive, I suppose.
Finding the solutions for her?
Finding solutions, and she just sat there and listened. I think I've mostly talked in the other one.
So it's about listening, it's not so much about talking. It's allowing the woman to confront her own behaviour and find her own solutions.
Yes, but I was very uncomfortable the first time.
Right.
Because it was something that was sensitive to talk about. Yes.
So your own discomfort may have been transmitted to the woman, maybe.
Possibly, yeah.
Well done. It's fantastic. Well, good luck.
Yeah, thank you.
Okay, Judy, so can you tell us your story?
So my story is to do with using these techniques in a group situation, an antenatal group. And asking the group at each occasion, and so how have you been going since last time we met, and waiting, and the pause, waiting for them to give some information,
great.
and then they tend to bounce off each other a little bit and give us the information without having to draw it out of them. And one group, we spoke to them and said, and how did you feel about having your weight being the topic of discussion? Were you embarrassed, or how did you actually feel about it? And one of the women said she felt that someone actually cared. And it was one of those group moments where there was a pause, there was nothing. We didn't say anything. We just waited, and then we draw a little bit more. So how did that actually make you feel? Did you want to do something about that? And then they just talked about what they could do, changes in their diet and changes in their activity. It was quite a moment in the group.
So the words you used were, how did it make you feel when somebody talked to you about your weight?
Yes, because they were embarrassed initially, but when we spoke about the risks involved, and they wanted to avoid those risks, and they knew the risks, and they knew they were overweight, but having actually someone say to them, you're in a high risk category, they were embarrassed about it, but they wanted to make a change. They really did. And the pregnancy was their motivation to change, and thinking about their baby and what they could do to help their baby was...
And were all the other women in the group, were they at similar stages of change, or did you feel that there were some women in the group that weren't ready to change at that time?
Possibly a couple a little bit ambivalent. They feeling okay at that stage, and so they didn't feel the need to change. But when... they talked about the risks amongst themselves as a group. They really wanted to do something about it, and when she felt that someone was caring about her personally, that was a great motivation, a great support, encouragement.
That's an amazing moment when you have somebody come out with those kind of words, because then you have something to work with. Did you manage to, when all the other women chipped in, did you manage to summarise their views and reflect that back to the group? Was that a useful technique?
At the end of the talking session, it's always good to refer back to some of the comments and summarise, and personally say, so-and-so said this, and we've done that in our groups.
Is it tempting in the group as a facilitator to say, well, if I were you, I would be doing that, or no, you shouldn't be doing that, or no, you need to be eating 3 pieces of fruit a day, and you need to be doing this, and you need to be walking through? Do you find it tempting to jump in there and come up with the solutions?
It is tempting, because you know the solutions, but they have to work out what they can do personally to help themselves. And when they hear each other say those things, that's the great motivator in the group situation. So you wait and you just let them come up with the solution, and they do every time.
So silence is your friend.
Yeah, absolutely.
So, Elizabeth, can you tell us a story about how you've used the motivational interviewing techniques in your practice?
After our first session, the initial session, the next day I went to clinic, and I saw this lady. She came in, and I knew her from her previous pregnancy, and she'd gained heaps of weight. And she was sort of around 20 weeks, and she actually admitted, and sort of said, well, I've got a lot fatter than when I had my last baby, and it's so much harder this time with a toddler, and this one. So anyway, she was just really funny, and I sort of said, well, what are you doing? And I started asking questions about her diet, because I didn't feel like I needed to ask permission, because she was just putting it out on the table.
Yeah. And
I said, well, how do you feel about all of that?
That was great.
And she sort of went, not that responsive. I said, do you think you could make a little change? Try something little, maybe with your diet, or maybe with your exercise.
So she thought of that.
She came back and actually said she'd have more fruit. So she was thinking about it. There was tiny steps, and then of course she got to about 28 weeks and developed diabetes, and that was the most amazing change. She saw the dietitian, and she became incredibly motivated.
So you saw her motivation change.
Oh, her motivation
from
changed
the beginning.
because she got the diabetes, and she didn't want to go into insulin like she was on last time.
Right.
And so she started to walk. She started to eat a balanced, healthy diet.
So what were the differences that you think you did with this woman?
I would have said, well, how about you do this? And I would have told her
So you
what to do.
prescriptive.
Yeah,
more than-
heaps more prescriptive. As even though I probably initiated a lot of it in the conversation, because some of it she just was like a stone wall.
Mm-hmm.
It started to flow.
So you use the
So
open-ended question.
questions.
How did she feel?
And
What did she think? What changes could she make? You used your
and
silences.
respected her when she
Yes.
couldn't do it. When she, that was far too big a change, I just went, okay, that's fine.
Lovely.
How about we try this? And she was willing to give it a small try. And certainly when she got the diabetes, it became this amazing motivation. And even after the baby's born, she was planning to stay on that diet because
It's incredible.
she saw that change in her own health. Her skin improved. And all of those things, and she was really happy with the changes that happened
So
during
her
her pregnancy.
confidence had increased along
Heaps.
with her motivation, and that enabled her
And she
to
was really
continue.
happy to talk about it.
Yeah. Well, there's no doubt that encouraging women to talk about their own needs and
Yeah.
the changes that they want to make will always be much more effective than us just telling them
Yeah.
what they should do. Hi Paula, can you tell us about your story of how you've used the techniques that we learnt in the training?
Yeah, I had this woman come in for a booking. It was her third pregnancy. And so we're going through all the normal sort of questions that you go through in a booking, and this woman was just so much stuff coming out about lots of issues, like she was self-harming and massive like family issues and lots of different things, and then she was overweight, and she had, you know, it was just amazing the volume of things that just kept coming out, and more and more every question came another big story. And looking through her previous notes, she'd never disclosed anything before, and this is obviously stuff she'd been going through for years. So I think maybe it was just how I was asking the questions this time that made it a bit different.
How do you think you were asking the questions?
Just leaving them open, not sort of being too specific, just sort of saying, I mean, the questions are quite specific that we're supposed to ask, but I think it was just the way I was asking them, how do you feel about this? What's going on? Do you feel like you're supported through this pregnancy and things like that? And she just took herself off onto all, you know, into different places. And so, but I think she was also, I don't know why this pregnancy, but she was ready to accept help.
Something had changed for
So
her.
yeah. So I thought it was more important to sort of tackle those personal issues first, rather than getting into all the healthy eating and lifestyle things, because it just sort of seemed secondary to all the other stuff she was going through.
Because we learnt in the training, didn't we, that if somebody has really low confidence, they have a lot of other things going on in their lives, and they have very low confidence that they can change anything.
She had nothing.
Yeah,
she wasn't going to change anything.
No, she was not motivated then to make a change.
But she was motivated to make a change with regard to other things. So straight away she engaged in like social work and the mental health services and counselling and all that sort of thing. So then, and because I had the great advantage of being able to follow this woman through her whole pregnancy.
Makes a difference.
Yeah, it made a huge difference. So by when she was, I think it was about 28 weeks, we were ready to sort of tackle the healthy eating and the healthy
So did you
lifestyle.
raise it again, Paula? How did you do that? She came back at 28 weeks, and did you then raise the issue?
We sort of raised it a little bit at the beginning, because we know we had to sort of keep track of her weight throughout her pregnancy, and by 28 weeks she had a bit of a leap in her weight gain, and so she wasn't happy about that. So that she brought it forward as well.
Excellent.
But she was also ready to accept some help with that.
So she reached that stage of change where she was ready to take some action.
Yeah. So, but it took from booking her in at 12 weeks. It wasn't until 28 weeks that we were ready to talk about these things.
Well, her confidence was higher, I suppose. Her self-esteem had risen because she was getting some help with her other problems.
Exactly. And so then, she was ready to start making, because she, like I know other people have said, she thought she was eating healthy and she was doing the right things, but just linking her in with some other services that helped her
And what
getting
changes
ready.
did she think that she could make as to change the way she was eating or exercising?
Yeah, I think it was with the exercise with her. She actually had the equipment at home and just never used it. So it was
Oh,
just
kind
actually
of
getting,
equipment.
like, she had a treadmill.
Oh.
Just getting her stuff off it and actually using it for, 20
Okay.
minutes a day.
So she
that was
started
her.
to do that.
Yeah.
Fantastic.
Yeah.
And how was she by the end of the pregnancy?
A different woman. Different woman. Like, it was one of the... Like, this woman, it was months ago, but she's still so fresh in my brain, because from that 12-week visit to the home visiting after she had her baby, she was like a different woman.
Awesome.
Yeah.
And Paula, would you have addressed those issues with her if you hadn't have done the training?
I wouldn't have been as confident to do it, because it's hard to talk to people about their weight, especially if it can be engulfed by everything else that's going on. So I think I'd sort of, one of the things I took away from the training was that you need to prioritise how you work through situations with women. So I had to realise that, yes, we needed to talk about this at some stage, but this wasn't the right time for it yet.
Fantastic. Well, you obviously did a really good job.
Yeah, she did a good job.
She did a good job.